I'm Dr. Fiona Moore. I'm the Executive Medical Director for South East Coast Ambulance Service, and we introduced iPads into the service some 5 years ago. Now every service is rolling that out, and I think that's great. We've certainly benefited from it.
We arrive at a scene, we get a kind of general idea what we're going to from the data from our control room and from the information on our iPads. However, fundamentally, we never really know what we're walking into.
We can sort of gauge from the reaction of the family members or from the people waving us down how serious the situation is, but it's not until we actually get to the patient. Hello there, what's your name?
Kelly.
Yeah, what have you been doing here today, Kelly?
Walking.
And what seems to be the problem?
My arm and my leg.
Your blood can be pumping and it can be quite sort of stressful before you get there, but it can, yeah, you sort of prepare yourself for a challenge. You not assume the worst, but you prepare yourself, yeah.
I think from the patient's point of view, they are in the main relieved to see us and glad that we've arrived.
You need some medical help, and that can be a bit sort of frightening for the patient, obviously, but we try and do our best to sort of calm them down and sort of remain calm. So Kelly, we think you might be having a stroke. We're going to get you in the back of the ambulance and get you to talk to one of the specialists, and we can go from there. Does that sound good?
Yeah.
Yeah? Okay.
The iPad is a useful tool as it has the benefit of giving us some additional information before we get to the scene.
It's very portable, it's easy to use.
The iPad, personally, I've used it a number of times just to get a second opinion of a more experienced clinician that knows more about the condition.
I think being able to call upon expert senior clinical help is really valuable.
Well, particularly with a stroke, it's really useful.
If your left arm is weak, we just take your right arm out. Yeah.
Please take.
Hello, doctor.
Hi there, how can I help?
We think we have a stroke patient that could do with your help.
Okay, great.
So Kelly, this is the doctor.
Hello.
Hello there. So, I'm Dr. Webb. I understand you sent on about 20 minutes ago, is that right?
Yes.
Okay. And any headache?
No.
Do you think you blacked out or lost consciousness, or were you fully aware all the time?
I don't really remember.
Close your eyes, just try and keep your arms where they are. Try and keep them up for me. A little bit longer. A little bit longer. Okay, that's great. Right.
We know that the hospital and the team are prepared. We know that our patient has a designated place to go within the department. Having that team on standby automatically means that that patient's going to get the right care much going
Well, I think we've demonstrated that it's a hugely influential tool for our staff and for our patients, and I'm glad that everybody else is going down the same route.